Alright, so for my fifth clinical, I had a 72-year-old female with past medical history of lung cancer, deep vein thrombosis, anemia, ovarian failure, and vitamin D deficiency. She presented to the ED because she had been discharged not that long ago, and she was supposed to have a home health care nurse visit her to check on a drain that she had placed in her left chest wall. So she was supposed to have a home health care nurse come, but something didn't work out with insurance, so the home health care nurse never came. And then on the 27th, she noticed that she was not having any drainage out of the drain anymore like she was. So, and I think she was also having some pain, so she ended up coming back. They admitted her, they did a thoracentesis, and then we're just kind of monitoring her, and we're gonna have pulmonology see her. So she had a left pleural effusion, or they called it a loculated pleural effusion. And so ever since she had lung cancer, she has had a history where she keeps having these pleural effusions. And so I was actually reading on the National Library of Medicine, they have an article on pleural effusions, and it was interesting to me because they say that they usually always start with an episode of pleurisy, so they're having that rubbing, so they're having the sharp, severe pain that's worse when they're breathing or coughing. But then it states that when the effusion develops, pain can subside, falsely implying an improvement in the condition. Constant pain is also a hallmark sign of malignant diseases, and depending on the cause of the effusion, the patient can also complain of cough, fever, systemic symptoms. So this is definitely a harder, presentation to diagnose, because it's actually, they may, whenever they have the effusion, may not even have any pain like they were, so they may kind of disregard it, or they may even presenting with more of the cough, flu, cold and flu-like symptoms. So it's definitely something that you would probably need to rule out with a chest x-ray, CT, or a pleural fluid analysis. And so for my education, or reflective measure, I was going to focus on education. And then I noticed whenever I was in with her, if she was having pain, especially to that left side, she wasn't really taking in deep breaths. You could tell that she was kind of guarding herself. And so it's really important to be using those spirometers, and just trying to teach them to still take those deep breaths, so that she's not desatting. And then for her, mainly pain was probably her, I would say her main symptom. And so I looked into Mary Elizabeth O'Brien's book, and on page 148, it talks about spiritual needs of the patient in pain. So it states that pain, whether acute or chronic or related to a malignancy, is influenced by psychological... Sorry, Remy is making her appearance well known in this video. Anyways, it says pain, whether acute, chronic, or related to malignancy, is influenced by multiplicity of physiological, psychological, sociocultural, and spiritual factors. Therapeutic interventions for relief of pain include pharmacological and psychological measures, as well as non-pharmacological measures such as biofeedback, meditation, relaxation, and guided imagery. She further states that Potter advised that in attempting to provide relief for those in pain, the nurse must remember that the patient interprets and experiences both pain and comfort in light of his or her own physiological, social, spiritual, psychological, and cultural characteristics. So that really stood out to me, because it's not only are there so many ways that we interpret pain, even as a patient, but also based off of where they're at and how they're interpreting everything and everything that is going on, that's also going to influence the pain. So it's not just how can we pharmacologically reduce their pain, but it's also like, how can we make this whole experience better for them? How can we make them comfortable, make sure that they're doing okay psychologically, and that, you know, all their cultural influences are being involved as well. So that was something that really stuck out to me, because my patient definitely was kind of just like being observed at this point for like pain. And so it's definitely important to just make sure that you're focusing on all of those sides of the care. So, but overall, it was like a really beneficial day, and it was interesting to me. I've had pleurisy as a kid, so I know like that pain. But it was interesting to me too to read that like whenever the effusion happens, like you may not even feel pain, and that's like almost like a worse thing because it can be more hidden. So it was definitely quite a learning experience with this patient, but overall a really good day.